The orthopedics department consists of myself, Mark Sheffer, and Dr. Willie Cater, who's a board-certified orthopedic surgeon. We're both general orthopedic surgeons, so we treat a wide spectrum of orthopedic illnesses. Orthopedic illnesses typically include diseases of the bone and joints, fractures, injuries to tendons, sports injuries, hand injuries and foot injuries, and also degenerative disorders such as knee arthritis, hip arthritis, shoulder arthritis, and rotator cuff tears. Our practice consists of both office practice and a surgical practice. In the office, we evaluate patients. We'll see patients referred from the emergency department, patients who schedule appointments or are referred from their primary care providers. And we'll evaluate these various conditions. Some patients can be treated purely with office treatment that may include cortisone injections, joint viscosupplementations or gel injections used to treat arthritis. We may recommend physical therapy. Sometimes we recommend surgery to treat orthopedic injuries or illnesses, and we spend roughly half our time in the operating room doing surgical orthopedic procedures. Those types of surgical procedures that we do include joint reconstruction or replacements, ligament repairs such as ACL, anterior cruciate ligament repairs, arthroscopic rotator cuff repairs, arthroscopic knee meniscal repairs, or removal of torn cartilage from the knee. We also plate and fix broken bones, fractures, a full array of hip and knee replacements, anything from partial knee replacements to total knee replacements, partial hip replacements, and total hip replacements. And we use really the latest techniques, including direct anterior hip replacement, which uses a minimally invasive approach, minimizes the destruction of surrounding soft tissue prior to the joint replacement, and really leads to a speedy recovery. Our patients depend on the season. In the summertime, we treat a lot of injuries, people who are visiting from away, and they may choose to have their injuries treated and repaired here, particularly if they're going to be here for the entire summer season. Some choose to go back home, and we may facilitate their linking up with an orthopedic provider in their own community. In the off-season, we tend to treat local Martha's Vineyard residents with a full array of orthopedic procedures, which we talked about. And so it really differs quite a bit depending on what the season is. There's a very close collaboration with our physical therapy colleagues. We also utilize physical therapy practices elsewhere on the island and are able to work with them as well. While the patient's in the hospital, we have physical therapy in the hospital or in the skilled nursing portion of the hospital. So we're able to work again closely with those patients and with the therapist to ensure that we don't just do a good orthopedic procedure, but also coordinate post-operative rehabilitation. I think that's very important. One of the benefits of kind of being an all-inclusive shop, if you want to use the term, on the island for orthopedic care. We're all under the same roof, and that works very effectively in coordinating care for a patient. In the Department of Orthopedics at Martha's Vineyard Hospital, our goal really is to provide comprehensive orthopedic care. That may not mean that a patient receives care from start to finish for a given orthopedic problem. It may include working with our colleagues in Boston at Mass General Hospital or Brigham and Women's or other orthopedic hospitals in New England. But really what we want to do is coordinate orthopedic care for our patients, and if we're unable to provide the service, get people to where they need to be to get the appropriate service. So I think here at Martha's Vineyard Hospital, we really need to recognize the fact that we're in a unique environment and people have sometimes limited access on and off the island, and we have to be able to do everything we can to ensure that their musculoskeletal health is coordinated well or cared for well here on the island.